All right, good morning, everyone. It's exciting to hear the energy and to see all the bright faces in the room. You made it back from the wonderful reception last night where we got to interface with the Dean's Council, and that was it was planned, and it was highly excited. We were highly excited about that because the Dean's Council wanted to meet with real students and talk, and kind of get a feel of what's going on in the college, and you all were very impressive in your conversations and your networking skills, so thank you for that. We are very pleased today to invite you all to join us for the Cottingham Colloquium. Just a little bit of information about that. It's sponsored by our Psychological and Counseling Services program, which, if you don't know that name encompasses both our school psychology program, our mental health, counselor ed, school counseling, career counseling program, so our MS-EDS programs, and our doctoral program. So it's all of us combined together because, we can do more together than we do separately. So all of us came together to provide the two speakers that we have today, which I'll be introducing in a moment. But the purpose of this program, there's threefold. First is to maintain the sense of excellence and leadership in the Psychological and Counseling Services program that typified the work of Dr. Cottingham. We'll talk a little bit more about him in just a second. Also to help students understand the ways that their graduate education and their training can lead and relate to diverse options for you after you graduate. So you're going to hear a couple of options today and a couple of different paths, and hopefully be inspired and maybe even awakened to, I could do that, or that's kind of interesting. I never thought of that as a possibility, because both of our speakers have had some interesting paths and work with interesting clients and have interesting stories to tell. And then finally, to build a stronger sense of community amongst us. So it's exciting when we see the energy, whether at the reception or here amongst yourselves. So I encourage you to continue that sense of what Dr. Cottingham would say, that spirit of conviviality, that enjoyment, that life as you interact with others, but try to meet someone you haven't met before and chat with them. So a little bit about Dr. Harold Cottingham. In 1958, he became the founder and the chair of the Department of Guidance and Counseling at Florida State University. He was a licensed psychologist and a founder of Eastwood Counseling Center in Tallahassee. He had two beautiful daughters, beautiful, bright daughters, one of which is here today with us, Sarah Cottingham. So please welcome her, who was a guidance counselor for many years, so shares our heart and our passion for helping kids and helping adolescents and into adulthood and to successful lives. Let's see, what else? For years, the faculty and alumni have sought to establish a new program and tradition which would honor the legacy of Dr. Cottingham. There are pictures, you can actually see a picture in stone when you go in of Dr. Cottingham sitting with legislators and everything. I believe it's on the second floor. I actually saw it yesterday, so that was pretty exciting to see. I know that man. I didn't know him personally, but all of this is attributed to him. And we come from his vision, which is pretty exciting. So to honor the legacy, Peter Scanlon, who you might have seen up there, an older man with white hair, nice beard, decided that he wanted to establish this program, this Harold Cottingham Memorial, to provide support for our colloquia focused on the professional development of you. So that's why we're here. Fall 2021 was our first colloquium, and we've covered a wide range of topics. You can see those on our websites, whether it's assessment or mental health, depression, looking at interventions in schools and so forth, as well as in other situations. And our program today is poised to offer a bridge between town and gown relations in the counseling psychology profession and open to all counseling professionals in our community, as well as alumni and current students and current faculty, previous faculty, and administrators, site supervisors, and so forth. So speaking of that, let's see who we have in the room. So how many of current students do we have in any of our programs? If you could raise your hand, let's see you. Oh, yay. Thank you for being here. All right. What about current faculty? Do we have? Yay, there we are all in the back. Yes, we're your support. We're behind you 100%. And let's see, previous faculty, prior faculty, way in the back as well, right here. Yes, thank you. Dr. Reardon, you didn't raise your hand. There it is. All right. What about current administrators, site supervisors, prior? Yay, all fantastic. Thank you, Dr. Dozier. We really do appreciate, I want to mention Dr. Rob Liddell as well, who allowed all the career counselors and career advisors to come and staff to come today, so made way that there was coverage for that. So fantastic. Is there anybody else? Friends? Anybody else I'm looking to see? Yes. Yes. Hello. Where are you from? Brazil, that's right. We do have some international, thank you for saying that, because we all, from Brazil, what other countries do we have represented besides the USA, Brazil, and Spain, and China? Oh my goodness, oh, more? India, wow. Panama, beautiful, wow. Sarah, wouldn't Carol be proud? I mean, the international impact, how exciting, how beautiful. Thank you all for joining us here today. So you've got your agenda, but one of the more important topics is where's the bathroom, which fortunately is right there. So there's the bathroom right for both male, female, and everybody right behind us. Right next door will be our breakout room, and when we break out in a few minutes, Fay Noil is going to be right there doing an activity focused on her work, and then Michael Morgan will stay right here, so that's where that's going to happen. And you've got our agenda, so we're just going to get into it, and I hope you'll be thinking of some good questions. We'll have a panel after they share a little bit about their journey here, and then they're going to go into more detail about relevant topics to their journey and the clientele they serve and so forth in those breakout rooms. All right, so let's keep moving. Okay, our first speaker knows a thing or two about service because she has done it all. Fay Noil spent 30 years in the U.S. Air Force, served as a deputy clerk in the court system, and now pours her energy into helping students as a school counselor at Carrollwood Day School in Tampa. She's the kind of counselor that doesn't just talk about problems. She rolls up her sleeves and she does something about them. And here's a fun twist. She once sang the national anthem at a Mariners baseball game, and her first horseback ride was around the pyramids of Egypt. Not a bad way to start riding, right? Please welcome the incredible Fay Noil.
Okay, let me hurry up. I have got to hurry up and get through my time. And those that met me last night, I'm getting up to this, so. But I know, so those that met me, I like to talk, right? So, and I do like to keep it real. So I'm a high school counselor, so I am who I am, okay? So if you came for something else, this is what you got, okay? This is it. And I'm going to tell you, if for some reason, look, I'm up here trying to look cute for you all. If these heels hurt, they're coming up, okay? I got you, so let's get going. Oh, yes. All right, good morning, good morning. Okay. So I will tell you, when I was asked for this opportunity, I'm like, oh my gosh, what in the world am I going to talk about? As Ms. Deb said, there is a journey. We all have a journey. But what I know is we're all here collectively because right now, at this time, our journey is about trying to make others better. So I share that part of the journey with you. And thank you for being here. Thank you for showing up. Thank you for doing what you are doing and what you will do. Because I will tell you, helping people, man, that's my jam. Right? Right? Yeah, look, I thought I would get a little bit more from y'all for that. Right. It is. So I will tell you really quick. I'm going to go through a few stories. I did have to cut a couple of things out. That's okay. We'll talk about it in the breakout. But what I share, we all have different experiences. And some of it might highlight some things that may touch you in a different way. Be kind to yourselves if you need to take a moment, because we do not know everybody's experience. Take your moment if you need it. So as part of my journey here, it starts at high school. That right there is a picture of my high school friend, Jody, from our yearbook. I still got it, by the way. And really quick, Jody was killed driving drunk. And Jody was kind-hearted. He took care of people. That was my friend. And one thing I ask is, man, if he had truly trusted me, would he have told me what he was going to do that night? If he truly trusted me, would he have told me his plans? I can imagine how his family probably was affected by the death. I can imagine that, but I do know how it affected our senior class. It left us with a moment of emptiness, not knowing where to take those emotions, not knowing how to really deal with those emotions. I just wanted to share that tidbit. As we talk about substance use, that's a personal journey for me that I dealt with in high school. However, that's not it. As Ms. Deb told you, I actually transitioned to the military. I did that. I was sharing with Sarah. I said, I went in the military because, can I keep it real? I was tired of school. Okay, look, y'all like we're in school. I told you, this is authentically me, okay? Is it okay? Right. I was tired of school. But let me tell you, about 3 years into my military journey, I was a security policeman. Those that aren't familiar with military, maybe you've been to air shows, maybe you've seen it on TV, it's the person that stands guard at the gate. And that was me. And one night, there was a red pickup truck headed towards me. It was going fast. It wasn't stopping. And I actually had to run to save my life. That truck ended up hitting the brick wall, flipped over, and it landed in the ditch. And I'm wondering to myself, why didn't that individual get hurt? I had some senior people there that kind of told me, well, let me tell you what alcohol does to you when you're in an accident. It causes you to relax. You don't brace for impact, and most of the times you prevent a lot of injury. That was the case. That was part of my exposure to alcohol in the military as a young person. See, I didn't grow up around a bunch of alcohol. That's not me. I'm learning as I go. And I will tell you that I can't remember a time where I did not attend an event or a social in the military where alcohol was not involved. That was my exposure to that. So I had a question. I said, how does substance use crisis manifest across different stages of life and institutions? That's kind of what I want to take a really quick journey through. And what are some of the most effective points of intervention and prevention? You see, my personal experiences provide a formal part or a experiential education, a practical, hands-on understanding that formal education couldn't actually give me, although it helped me, through observing the lived experiences through the different institutions. What I learned about myself is I am not the enforcer, I'm more of the advocate. As a young kid, guess what? I didn't know that. I had to go through things to figure that out about myself. You know, this motivation for me, it's not just personal. It's fundamental to the work I currently do, because what I realize is, despite whether it was the military or, as Ms. Deb said, the courts, or going to school, or working currently as a high school counselor, what I realize is effective solutions for substance use, it must be holistic and integrated across the institutions. That's why we continue to have issues. We can't continue to operate in silos. So one of my challenges here at the end, because we have a variety of people working in different spaces, is wouldn't it be great if it was all connected? And I left one institution and it was a handoff to the next institution. And we really cared for people as they went through their journey. Wouldn't that be amazing? Yes, babe, that would be amazing, right? It would. So, but before we go deeper, I just, really quick, y'all make sure y'all keep me on my time, okay? Look, really quick, I will cover some of these things. These are just, we're dealing with school. It's not a test or anything. I'm just going to use some of these terms. That's where they're at. And this is really my journey. So when I started in the military, like I said, I remember later in my career, I came to work. I was later, much older, senior in rank. I had got notification that one of our new troops, he had only been there 1 week, and 18 years old, I got the notification that he had hung himself in his locker. He had personal problems. His girlfriend had just broke up, and he was an excessive drinker. Only reason we know that is because the note that we found. And I think about if that individual had had the support, or if I was in tune to be able to support him at that time, would that have been his outcome? See, that night, not only did we lose a military member, we think about that, but I think about that family. I think about that girlfriend. I think about that girlfriend's family, how they were affected then, but I guarantee you they are still affected now. That's what we talk about. When we talk about holistic care, it's not just about, hey, in the moment, we journey through life bringing our stuff with us. We all got a bag. We all pack a bag. And in that bag, guess what? We got stuff that happened when we was a kid. We got stuff that happens in high school. We got stuff that happens in college, stuff that happens in families. It was packing that bag. Anyway, that was a thing for me that transitioned to say, I've got to move to a different career in the military. I changed positions more to the helping role as a first sergeant. Anybody familiar with the military? Okay, so I was a first sergeant. The first sergeant is like the human resources person, or maybe the coach. I used to tell people, it's like the mama of the squadron, okay? It's like you do all the care and feeding, morale, welfare, but you also had to deal with the discipline piece. And what I want to highlight here is there was an individual, and this is kind of to show the military had a zero tolerance type of stance when it came to substance use and abuse. It was governed by the Uniform Code of Military Justice. And although they had a program, it's currently in existence now. It's called the Alcohol, Drug and Prevention and Treatment Program, okay? And there was a young man. I was called out to the wooded area out there on base. And there was a young man who had been in the Alcohol, Drug and Treatment Program. And he was drunk, extremely drunk, in the woods with a knife, threatening to harm himself. I got a call, guess from who? Security police. That was a job I used to do. Can you come and help us with this individual? I found myself, because we had a relationship, talking to him on his cell phone, talking him down and talking him out. How did that come out, Fay? It was great. He was safe. But let me tell you what happened. It wasn't too long after that, because of the system and how the military works, he was discharged from the military because he failed the program. Now, that individual left out of the military with those problems that he had. They were packed up with him. And guess what? Now he was part of the broader society. Faye, what are you saying? I'm saying all that to say this. I thought I was in a position to be able to help, and I said, this isn't right. Hence, that's why I ended up at Florida State University. I have got to do something different. I did the courts a little bit. I'll save that to talk about over there. I did the courts a little bit. But then I journeyed to say, look, I have got to learn different. I got to do different. It has to be better. And I will tell you, this is great. I did the school counseling program through distant learning here. And one of the things that I took away that sticks with me, that I use in my work today, that I wish I had had in those various places, was when I discovered person-centered the therapeutic approach. You know, we talk about having our jam. Look, it speaks my language. I'm all about unconditional positive regard. I'm all about empathy. And if you haven't figured it out, that congruence, genuine stuff, that's Fay. I like to keep it real. I said, I have found the thing that not only is evidence-based and it's going to help me to help people, but it speaks to the person that I am. And I had no idea going through all of that walk of life. I mean, this is more than 30 years of life to get me to this point. I had no idea this existed. What I say with that is what I use in my work today. I think one of the things when we talk about actualizing tendencies, when we believe that people have the innate ability to heal within themselves, when I am sitting before high school kids, that's how I approach everything that I do. Whether they come in and guess what? Maybe they were drinking that night before. Hey, in the world that we're in now, it's not unusual for them to come and say, hey, I was doing marijuana. Guess what? My family. I hate my dad. These are the things that come. You just never know what's going to walk through the door. But what I realize, although I've had a journey, don't judge it. Walk with them through the journey. That's what they need. So hopefully, our call, what we're going to do in our specific professions is, I think empathy is the main driver for that. It is. And if we had more of that in our world today, I think it would be a better place. So guess what? I think it starts with us. Any empathetic people in the house? Okay. With that, I think I'm close to 20, and I want to get off. There's so much more to go through in the story. So thank you all for giving me your attention. Thank you all for going on this short journey with me. You could imagine in 30 years of time, I got a lot of stories. Yeah, I do. But I'm grateful to be here. I'm grateful that I was given this opportunity, and I'm grateful to be a part of a profession of people that has people in mind. Thank you.
All right, thank you so much, Fay. How encouraging, how inspiring. I hope you're hearing some opportunities and some encouragement in your own journey as you're thinking about where you are in your program, no matter which program it's in, but that common core, that common value that we share in helping others find their way. So thank you. If you want to hear more, after our panel discussion, she will be across the hall. So our next speaker is proof that psychology can take you just about anywhere. Dr. Michael Morgan is a licensed psychologist who helps veterans heal from PTSD at Emory, runs his own practice in Georgia, and still finds time to publish, present, and even co-author a book chapter for school counselors. And here's the curveball. He also teaches financial professionals how to use psychology to make their work more productive and profitable. Talk about range. Please join me in welcoming the magnanimous Dr. Michael Morgan, Jr.
Good morning.
Good morning.
Very happy to be here. I can say unequivocally that I wish there were more school counselors like Miss Noil when I was in high school. You know, having worked with the VA, worked with veterans, I can tell you that if you want to join that lifestyle and you want to advance your career, you do what the CO says. But if you want to survive, you do what the first sergeant says. And so I would love any opportunity to talk to the children that Miss Noil has the chance to assist, because I'm sure it is world class. Yeah. So, hypothesis testing and a life of service. I agonized over what to title this, and I went back and forth and back and forth. And I went with this. So I'd like you to think about, in the next slide, what hypothesis would you generate? And we're going to explore a little bit what you think about what's going to be coming up and how you can apply this idea of hypothesis testing in your career journey. Look at that guy. Isn't that guy cute? It was before the weight of all my sins weighed me down and changed my hair color. So what do you think? What are your first impressions of this little lad right here? How would you describe this person? What they're going to become? You know? What's your hypothesis? Well, how about small business owner and entrepreneur, right? How about Center for Career Research Associate? That was not something that was on my bingo card, but I'll tell you, that is a feather that I will wear in my cap every day. And then I have scientist practitioner. See, that piece right there tells you more in some ways about my values than anything else that's on this page. I chose hypothesis testing because of that scientist practitioner piece. I bring that into every bit of work that I do. It infused in a big way. A big piece of the breakout session and some of what I'm going to talk about today has a lot to do with evidence-based psychotherapy, evidence-based practice. I remember going to NCDA the first time, and there was a panel discussion up there from different career theorists, and we had the wonderful Dr. Janet Lenz up there. And everyone was talking about chaos theory and blah, blah, blah. And Dr. Lenz came in and said, well, the evidence says this. And she smacked him down. And I thought, that is what I want to be able to do. I want to make sure that whatever heart that I'm bringing to my work, it's backed up by the research so that I can continually grow and continue to make sure that I am delivering the most high quality services that I can possibly develop, right? So I would encourage you, as you're on your journey as well, to have your hypothesis, and you'll see a little bit about how it is that I've tested mine in my personal career journey. And then down here, I'm currently seeking multiple board certifications. I'm in the middle of, I just submitted my practice sample and got back my revise and resubmit, which is just a lifetime experience for anyone in psychology. But once I do a couple minor changes, I'm on to section 3, which is the oral exam, and then I'm board certified in cognitive behavioral therapy with ABPP. If you're going to be going into psychology, I highly encourage you to consider board certification. It puts you on an even playing field with most psychiatrists. That's where you, in some ways, want to be. If you want to be an expert witness, if you're up against someone that's board certified, you want to be able to say, I'm board certified too. Then we've got ABPDN. This one's a strange one that I didn't know about, but I was exploring my options. This is the American Board for Pediatric Neuropsychology. This was not something that I had on my bingo card either, but it was something that I was pursuing, and I found an individual that's helping guide me through this process. So in about a year and a half or so, with more consultation and supervision, I'm applying for this board as well because it is integral to the work that I find myself doing most often today. So how did I get here? Well, we've got these two different ways of getting to where you're going to be going. I love to think about them constantly. And this question that I have right here is something that I ask my clients that are old enough, you know. Who do you want to be? Before I came in this morning, I was driving around campus reminiscing, feeling nostalgia, and I saw these wonderful things that say, what are you going to become while you're here? And I thought, man, they're biting my style, you know, because I love this idea. Who do I want to be? And I can tell you, when I began my career journey, I was in my undergrad at Georgia State University. We'll talk about that a little bit more, right? But I couldn't go through this lecture without bringing up CIP somehow, right? And so I developed a hypothesis about myself, about who I wanted to be. I remember sitting in my first research methods class at Georgia State, and I had to do my paper, and I was doing lit review. And I found myself learning new ways to find articles. And if anyone's interested and you're doing Lit Review right now, one of the best ways I recommend doing that is find a good article and then look what references they used. And just keep deep diving on references as you go along, and you learn more and more. And I found hours just flying by. And I thought I could do this every day for the rest of my life, and I will never, ever get bored. And it was in that moment I decided I want to be a psychologist. This is what I want to do. It's because of my love of research, right? So all of a sudden I had my why, right? Viktor Frankl, absolutely stunning individual, wrote Man's Search for Meaning, highly recommend it. There's lots of great books that any person in this field I would recommend reading. His is one of them. Now, he's also really important for the work I did because I ended up finding myself doing lots of work with PTSD and veterans, right? And Viktor Frankl, if you're unaware, survived the Holocaust in Auschwitz, and then he wrote this book. There is a lesser known individual that I like to talk about too, though, named Dr. Edith Egger. Viktor Frankl was a psychiatrist. Dr. Egger is a licensed psychologist, and she too survived Auschwitz. And what she wrote recently is a book called The Choice. She became one of the head psychologists for the U.S. Army in treating PTSD. And she said, embrace the possible, right? So I have this idea of who I want to be, but then I have a question of how am I going to get there? And I use the Kasave cycle for this, right? So we have such great tools in front of us developed right here that we get to continue to build and grow. And it worked in my life too. And so I began to actualize my journey through the execution phase, right? I had my idea of where I was going to go and how it was going to take me there. And in my undergrad, I knew I needed to do some research, get invested so I could get good letters of recommendation. And I worked in a pediatric neuropsychology laboratory because I knew I was going to go into neuropsych. And the work that we did was absolutely fundamental and foundational, working on markers of survivability and functionality in pediatric brain tumor survivors. And it was depressing. And I thought to myself, I never want to do this. And so I jumped all the way to the opposite side of the spectrum, and I decided I was going to go into working with older adults. And I also decided I wasn't going to do clinical work. Isn't that fantastic? Look at me now. Here I am coming full circle, right? So how is it that I got here? Where did my journey take me? I have been associated with like 10 universities at this point. I started off all the way in 2010, graduating with my Bachelor of Science. And this is organized, it may seem haphazard, but they're placed in a spatial relationship with each other, representing different parts of my educational journey and what happened. 2010, Bachelor of Science, Georgia State University. 2011, the Georgia Institute of Technology, where I was in the Human Factors and Ergonomics PhD programs, considered one of the top 4, top 5 engineering, psychology, industrial, organizational programs in the nation, in the world. Big stuff. And then my life was disrupted with illness and alcoholism. And I lost my NIH fellowship, and I was made 2 Cs in the same semester, and anyone that's in graduate school and PhD program can tell you what happens when you make 2 Cs in a semester, right? So here I am in 2014, defending my master's thesis in, oh, you're gonna love this, understanding how our brains process numbers and how that's impacted by aging. It was a real page turner, happy to share it with anyone who'd like to read it. And I became associated with an organization called Midway Recovery in rural Georgia, very small organization that had people smoking inside of it for years and years and years. It smelled, right? And I became invested in recovery and in volunteer work with this organization. And remember, though, I still had this inner piece of me that said, I have a why. I want to be a psychologist. I refuse to give up. You see how big that gap is until 2018 with Florida State University. That's on the equal footing with Georgia Tech because that's my doctoral work. 2 separate doctoral programs, 7 years apart. Why did that happen? It was because when I was at Midway, I kept applying for PhD programs and no one would give me a chance. I had a black mark on my CV. Nobody wanted me. But I didn't stop. I was still in the execution phase. Something didn't work, and so I found another path. Embrace the possible. I started off at one place. I had to find a new path. So I applied for a degree as a Master of Science in Clinical Mental Health Counseling. I assume there's some people here doing that right now. It's a beautiful way of life. It is beautiful work, right? I learned more about myself. I learned more about how to develop relationships, and I kept applying. How many people are familiar with how long your GRE scores are good? Yeah? Yeah. And so when I applied to Florida State, while I was at Mercer, a kind professor allowed me to do research with her, and it just so happened I was introduced to CIP in their rehabilitation counseling practice there, and I became involved in a study looking at the acceptability of computerized career counseling services for indigent individuals. And it was through that work that I was given a chance to come here to Florida State. And it was a beautiful thing, and I loved every second of my time here. I really, really did. The amount of gratitude, whew. I cry when I am talking to people so frequently. Okay. All right, we're through it. Fantastic. We went on another journey together, didn't we? And with my time here, I squeezed every drop out of my time here. I became the president of the Congress of Graduate Students. I started hypothesis testing other things. I started looking at, I was working on my dissertation. I wanted to learn about career exploration behaviors. There is an instrument out there, and I decided I didn't like it very much, and so I went looking for more, and I decided, well, before I do my dissertation, I better translate this instrument from South Korea into English and validate that bad boy, and so I did that while I was here too. I wouldn't recommend it. Just go ahead and do your dissertation. Don't do 2 or 3 along the way. It's fine. You only have to do 1. And through my work with internship, I was lucky enough to take a spot with the Medical College of Georgia and the Charles Norwood VA. And this is where a bit of my experience became integral again, because at the Charles Norwood VA in the Substance Use and Rehabilitation Center there, CIRC, they adopted me because I came with a different experience. And they instantly, after 2 or 3 times meeting with me, said, this guy knows what he's talking about when he's talking about addiction in a way that a lot of people don't know. And while I was there, I was their trauma track intern. So I got trained and certified in cognitive processing therapy and evidence-based psychotherapy. When it comes to treating PTSD, this is something that I would encourage you as psychosocial providers to learn. What are your areas that you can say, I can do this thing better than medication, right? If you want to be able to sell your rarity, find those things that the evidence shows, I'm going to do a better job treating it and have better long-term outcomes than any psychiatrist is going to give you. Treating PTSD is one of them. Treating substance use disorder can be another one, depending on how you look at it and where you look and how you do it, okay? And so because of my dual emphasis in substance use and PTSD with the VA, I was accepted into a prestigious fellowship with the Emory University Veterans Program, doing cutting-edge research, stuff that I had never dreamed of. I was taught how to do prolonged exposure therapy by one of the women that invented the treatment, Dr. Barbara Rothbaum, and Dr. Sheila Rausch, who helped write the newest manual as well. And they do it in such an incredible way, doing massed treatment. We can take an individual, it's fully funded by the Wounded Warrior Project, and we will take people that are members of the Joint Strategic Operations Center, JSOC, special operators, tier 1 operators, and they will send them to Emory because we can go from full-blown PTSD, debilitating PTSD, to in remission from PTSD and mission ready again in 2 weeks. We do the entire prolonged exposure therapy in 2 weeks. And at the exact same time that we're doing that, we're offering substance use treatment too as well for individuals who have difficulties with addiction and PTSD. And guess what? There's a lot of them. Estimates suggest that at least 40% of individuals who meet criteria for PTSD also meet criteria for substance use disorder. And the research shows that if you want to be able to treat the PTSD, you got to treat the substance use disorder at the same time. If you ignore it, it won't get better. So how do we do that? What does the evidence say? Well, an interesting thing to know about this is what is the remission probability? Does anyone know how long it takes to go into remission from a substance use disorder? 90 days. 90 days of abstinence. But for sustained remission from substance use disorder, you need a year. And the numbers are pretty miserable, right? If we just look at the column for remission probability in the year 1, right, or in the first decade, for alcohol, it's about 3% down there for the first year. But if we look at the lifetime remission probability, there's a lot more hope, right? 90%. But what does that tell you? That tells you what are the odds of a person over the course of their life remaining abstinent for just 1 year. How can we help them remain abstinent longer than that? How can we help them get 15 years, 20 years, 30 years? It's entirely possible as long as you're delivering the best kinds of treatment available. But what kind of treatment is that? Well, I can tell you that the most common treatments that we use have little long-term efficacy. These are, one is CBT-SUD, so that's the one, this is contingency management, and it's considered one of the best evidence-based treatments for stimulant use disorder. And you've got a meta-analysis there on the right, and that little diamond on the bottom can tell you what the effect size is. And we've got a good effect size for contingency management while they're in treatment. But then at 6 months, that little diamond is crossing 0, no effect anymore at 6 months following treatment. How about CBT-SUD? This is also the most popular, and this is the one we would integrate at Emory, and I was a little bit of a loose cannon in some way. I said, this is good, but we're missing some of the important stuff. The effect size of CBT-SUD at 6 months following treatment goes negative. It no longer continues to offer the same impact on abstinence following 6 months of leaving treatment. What are we missing? There is something called the Physician's Help Program, and it takes a completely different approach to treatment. It looks at abstinence and sustained remission. They have a 5-year goal. To be a part of this program, you have to be a licensed physician, and you have to be essentially caught using substances that it has impaired your ability to practice medicine. And then the state will order people into this program. And in the group of people in that orange box over there called completers that follow their entire program there, they have a 90% success rate with the completers of their whole program over 5 years. And so in my breakout session, what I'm going to do is talk a little bit more about how it is that the Physician's Help Program is able to get these kinds of results. What do they do different than CBT-SUD and contingency management, and how is it that you can do it too, to combine evidence-based psychotherapy for PTSD and substance use disorder? Thank you so much for your time.
I'm Farina. I'm in the counseling and school psych PhD program. This is a question I think either one can answer because it's about like treating veteran populations. As somebody who's interested in working with veterans, like, what do you feel like is the most overlooked part of like preparing to work with this population? Like something that you think everybody should know either going in, or like a skill that people should develop that isn't typically thought about, like when someone's thinking like I should go work in a VA?
Sure. You want to go first? Okay, so there are two ways of looking at this. When you're getting trained, in the VA, what they'll want you to do is learn about military culture, okay? And so you're going to be acquainted with military culture, and you're going to have little PowerPoint slides and stuff you got to do when you're getting trained, okay? And that's good. We definitely want you to be able to know that. At the same time, the thing that I personally think is most important to know is that veterans encompass a large proportion of the United States population. And in some ways, it actually represents, in my mind, one of the most representative samples of the entire United States population you could possibly get. And so what I think gets overlooked the most when working with veterans is that they, in a lot of ways, are much more like the civilian population than many. They get placed in this category where in some ways they become othered and they become different. And if you meet one veteran, congratulations, you've met one veteran. And so what's most important, in my opinion, is to be able to still recognize them as individuals while also keeping in mind their group membership, just the same way as you would considering any other diversity area when working with an individual. Both view them as how it is that their personal, their identity is shaped by their group membership as well as their individuality. Okay? Yeah.
I guess, right. So considering I am a veteran, I'll just share an example. I did 30 years in the military, and as Michael is sharing, you're in I would say you want to call it a brotherhood, or you have this structure. For 30 years, I did military. That's all I knew. I came out of high school, and that's all I knew. There's regulations. There's the times you're supposed to show up. They tell you what to wear. They tell you when to go eat. It's like that. There is a hierarchy. There's a chain of command. There's all of those things that when you live that life, that comes with you. You know how we talked about packing it? That's part of it. I remember when I actually retired, one of the hardest things for me was leaving that environment and going to civilian world. So it's like I had to reprogram myself. I'm still being reprogrammed. I've been rebooting for years. Yeah. So I think, to your point, you remember the experiences that they bring with them from a structured environment. That although we may say, well, we think you should maybe think this way, that also may take time for that to be reprogrammed. Just as an individual, who they are and the structure. If I just add to that, okay.
Hi, I'm Lei. I'm a new faculty here at the Cottingham Colloquium program. Fantastic talk. Really made me think a lot about our work with children and their family. I want to follow up on the conversation about the environment and tie back to treatment, right? Evidence-based treatment are often in a controlled environment. And my opinion, for the students who are having substance use issues, is that there's this gap between what we do in the therapy group and their real life situation. And I think that's one reason why relapse is such a high rate of relapsing. So I wonder, what do you do in your treatment? Do you have this component of connecting what you're doing in this lab with their social ecological system outside of the research?
Yeah. It's fantastic question, right? We always have rigorous controlled experimental conditions, and with much of the testing that I do, there's always the problem of ecological validity, right? Now, I would argue in some ways this is the reason why we have the difference between efficacy studies and effectiveness studies, where we want to see in the nitty-gritty and the ugliness of the world, how well is our treatment going to continue to work out. Now, with the evidence-based interventions that I enjoy using the most, you'll find that the problem tends to be during treatment, not what's going to happen outside of the therapy room, but what happens in the therapy room in difficulties with fidelity to the treatment, okay? And so when we see with prolonged exposure therapy, with PTSD-related therapies, the bigger problem isn't necessarily what happens in the social milieu, it's really the difficulties where the provider also experiences some hesitancy with some of the treatment. If we view PTSD, and this is essential in substance use treatment at the intersection of PTSD and addiction, because the foundation behaviorally is avoidance, okay? And so we need to treat the avoidance. The avoidance is the problem at this point because it's stifling natural recovery. And that avoidance shows up both in the therapy room and in the person's social life, and in the use of substances to prevent themselves from experiencing uncomfortable thoughts and feelings. And so if we're creating a really strong exposure hierarchy, we're going to be asking that individual to engage in the world around them outside of the therapy room in new ways. And so we're asking them to take what we're doing in the therapy room out into their life and their lived experiences in the ways that they know can work best, while removing some of the avoidance while they do it. And what ends up, it's such a parallel process in consultation and training people in these evidence-based approaches to PTSD, because I as a therapist have to do the work and find out, where am I going to become avoidant? Where might I say, no, the client's not ready for this piece of the treatment yet? How is it that my avoidance in the therapy session is going to influence what they do when they get outside of the therapy session? And so from a practical perspective, what tends to be the bigger problem in the treatments that I deliver ends up being fidelity.
Yes,
Hi, Chris Lefevre. I've got 1,000 questions for both of y'all, but I'd love to hear, both based on familiarity with research and your own experiences, because I've seen some research and had some experiences how youth substance use looks different a lot of times than like working with adults with substance use. So based on the research and experiences, how have y'all seen that different, or how have you approached supporting youth who are dealing with substance use disorders differently?
You go ahead.
Yeah, so it's interesting when you talked about, as a school counselor, I think one of the things we have is a community of people where we do that referral and handoff. And some of the times, when we talk about fidelity, the issue with that sometimes is when we don't have that connection with the outside provider, or the family's not also involved, it's very hard for what you can spend all this money, all of this time doing your therapeutic approaches in the office. But I tell people they spend most of their awake time in the school. And if we don't have some sort of, and we're talking about collaborative and holistic approach to that, it's almost like you're spinning your wheels. I wish people would understand that, Michael, that as a support in the school, because when we're dealing with drug abuse, I will tell you, I think I was sharing with someone last night that drugs are in the school. I think drugs are in the school. They know where the cameras are. Boy, they use the bathroom like it's a shopping cart. It's interesting what they're doing to consume drugs, marijuana, vapes, pens, prescription drugs. And the way when you talk about how it presents itself, Michael, you can speak to this more than I can, but it's a secret. It's always a secret, except when it's alcohol. And the kids will always talk about when they had the party and they did this excessive drinking. That's still happening. I don't know about anybody else, but in high school, as you saw it was happening. Anybody else, was it happening when you were in high school? It's still happening to the excess. So to your point, when we see it, we're looking for a great handoff and a partnership that we could help, because we know that it's happening in the school. We need to know what the provider on the outside is doing so that we can support it on the inside, so that that person can get well and get whole and end up at a place where they're not dealing with the substances. So to you.
Yeah. Anecdotally, now I can't tell you where my source came from for this anymore. Freud hated taking any patient that lived with their family, okay? And part of that is when you're in that environment, if you change the individual but the system doesn't change, you're basically doomed. And so when you look at evidence-based interventions, typically for younger people, the most effective one that I know of for severe substance use concerns in adolescence is going to be multisystemic therapy, just like Ms. Foyle was talking about so well. If you don't address the entire system, it's not going to change for that adolescent. And so with adults, independent adults, we get the luxury of treating them as an individual unit. Whereas if you're going to work with adolescents, I just sort of have a standing recommendation for every intake that I do that involves a teenager or a younger child. Hey, we're going to do this sort of treatment, working with your child. And oh, by the way, have you considered doing some therapy too? You know, and so just this awareness that one, with adolescents, it is rare to see the same level of progression in addiction that you're going to see. So oftentimes the level of treatment that's necessary can be different than what you would do with an adult with severe complicated PTSD type presentation with severe substance use concerns. With them, what matters more in some ways is sort of like, to my knowledge, some of the most successful treatments for anorexia in adolescents is a family-based intervention now. And so if you don't address it at that unit for the children, the change isn't going to happen that you can get with adults as an individual. Yeah.
Yes. Think about.
Follow up on that, with both of you, the speakers. When we're working with families, especially when we're talking about systemic support, I think about how that really works. Who would take on this responsibility to do this systemic support, or at least lead this systemic support? Because when we're in school, there's limited. I've seen school psychologists being hesitant to do this work because they think supporting parents are not their job. And then in a hospital setting, some doctors may just prescribe you should get a child a kid IEP, and because that's because they think learning is not their job, it's the school's job. So there's this diffusion of responsibility that makes this kind of work so hard to be actualized. I wonder, what do you envision? Who will be the best person to do this kind of job, or what is it really just up to the individual? What do you want to do?
Look, I think everyone, because in the school, you know, when we talk about that person-centered approach, you've got to realize that the individual standing there before you, when I have a student, I know that student has all of these lines leading into that student. They have parents, they have friends, they have their extracurricular activities, they have their coaches. And so I think if everyone is speaking the same language, it makes it easier. So even if we talk about when we do the referrals to our psychologists, we know that the family, like if the family is involved in that process, it's great if the psychologist is also speaking the same language. Look, it would be great if you let the school know kind of what's going on so that they can help you in the school. And then as the school counselor, hey, I know you all are seeing a psychologist. It would be great if you tell the psychologist so that we can do release of information so that we can all be on the same team. So I think everybody has to have the mindset that it's one team. One team. We all have different parts of the team. Look, I'm the catcher, you're the pitcher, hey, you're the first base, but guess what? For us to win, we got to work together as a team.
I agree with everything that she said. The problem is, and this is one of the things with, so I work in an area of rural Georgia I am the only licensed psychologist that practices in my whole county. And there are several counties around that don't have a single licensed psychologist that practice in them as well. My guess is that I'm the closest for, if you drive like a 1 hour distance around where I'm practicing, there's probably 100 to 150,000 people that I am it, okay? And what happens is, I know that multisystemic therapy is the best way to address a lot of these problems for these children. It is completely untenable. The school systems are impoverished. They're some of the worst in the whole state of Georgia. And I have school systems right now where I have children with autism, and they are actively resisting providing them with an IEP so that they don't have to put their resources into the children that need it. If in my area, if I have one good physician, if I have one parent, there are few things that excite me as much as when a child comes to my practice and both of the parents come to their appointment. That is such a miracle, because the prognosis just dramatically increases. And so if they have, I'm certified and working in the Incredible Years program, if you're familiar with the Incredible Years program. And so one of those things that we're training parents in doing is that I am helping the parent learn as well how to better advocate and communicate with their teachers. Because the teachers or the different school systems, they don't have to listen to anything that I say. I've gotten to be part of one IEP meeting, but it was in the elementary school, and when you jump from elementary to middle school in that particular county, good luck on getting the services you need anymore. And so really being aware of the geopolitical context that you're in when you're practicing, and knowing, okay, we know this is what's going to work the best. How can I adjust my expectations for my setting? That's essential. Yeah.
Hi, I'm Michael. I'm a first-year clinical mental health counseling student. To both of you, my question is, do you have any tips, tricks, or guidance on facilitating effective collaborative care amongst like other professionals in health-related settings like doctors, nurses, practitioners, etc.?
Whatever it is that you want to tell them, get it down to 2 sentences. So in the VA, there's a big emphasis on primary care mental health integration in a hospital setting, and they lead in embedding licensed psychologists in the primary care setting. It is one of the best avenues of intervention, but you also have to ask, well, what's the doctor's pain point? What's the nurse practitioner's pain point? How is it that I can tell them very quickly how I am going to help them? And so when you think about what their concerns are, high blood pressure, diabetes, sleep, those kinds of things, when you get really good at communicating in 1 or 2 sentences how you're going to address their behavioral health needs, they listen a lot longer.
And I have a question related to the person-centered approach in the schools. I really appreciate your emphasis on that person-centered approach. And I was wondering how you felt the ideal of the person-centered approach worked in reality depending upon your caseload. So I am, I guess, curious what your caseload is. I understand you're working at a private school. Is that a better caseload than in public schools? And yes, just basically how can you be person-centered in a setting where maybe the ratio is not ideal for that?
No, right. Thank you. You're right. So let's keep it real. Fay, you have 450 students, right? It's easier for you. I came from a high school, Title I, where there was 1,200. I think, and this is all of us. To be person-centered, I don't have to have 30 minutes. And so I'm walking down the hall, and I know the student's name. Hey, how you doing today? And I'm like making those connections in the relationship, and like, oh, how did that game go? Hey, I know your brother was out. making those small connections with this limited amount of time you have, because I understand what it's like when you're in a public school setting. Not only are you trying to do the counseling part, you're trying to do the IEPs, the 504s, the schedules, and all the things, right? So it's hard, but even in those moments, taking the time to really see the person for who they are, I try to do, even in the environment that I am in. It's busy, and all I do is counseling. I shared that with someone, which those that are going to school counseling would be like, oh my God, Faye, that's the greatest. It is. But it is from the time I get in to the time I leave, my door, somebody's always in my door. So even having time for that is limited, even in my environment. But what I realize is when I show up to the game, when I show up to the concert, when I acknowledge who they are, I'm doing the work outside my office, which helps me inside the office. So, okay. Is that? Sure. Look, you like Faye? Okay. How about this? Because you all, I wish we had the opportunity to speak to those that pour into, I would say, education. Education and the connection with outside, with mental health and therapy as a whole. I say it at school. I said, emotions and mental health is in everything. Everything we do. And it's hard for people to see that. Well, look, I'm just showing up to class. You got some emotion tied to the test. You got some emotion tied to the book. You got some emotion tied to even if the toothpaste worked or it didn't work this morning. There's emotions in everything. And I try to populate that message so that people realize, I'm going to just tout on, you need us. We just want to make it better. That's it. So we need more money. We need more funding for mental health. We need more funding in our education system. I wish we wouldn't pull back the money from that system, but pour it in. So if there's any future presidents in the office, remember that. We need the money in the education. How are we going to have a better world if we don't continue to pour into that space and deal with the mental health and dealing with the anything that we do and the anxiety that may come with doing that? We need that. We need that. So I think you probably have something to add to that. I believe I do. I am so excited, man, that I get to look. It is. Yeah.
Yeah.
Well, to close this out, maybe you all, because we are here as a large group, is there any closing thoughts, or are there any closing thoughts that you might have for this group of students? They're at different places in their journey. Anything you'd like to share in closing thoughts, or a pitch for your session, or anything like that? How to stay current, or any advice at all? Just a closing word from both of you.
I would say that, once you have your idea of where you want to go and what you want to do, be prepared to assimilate and accommodate new data, right? If you're going to approach your work with the scientist practitioner mentality, that means that as new data emerges that suggests that maybe our hypothesis wasn't so great, that we update our hypotheses as we go. Where you are, with what you're doing. And it's just like CIP says, there is no perfect choice, but there is an optimal choice for right now. And that is okay, because as long as, so with my, I picked a life of service there, and that's because I have dedicated myself to being a contributing member of my community and making sure that I use my life to help make things better, right? How I do that doesn't have to align with what I originally wanted for the impact that I make to be fantastic. So as long as you have that clear why, you're able to embrace those possibilities as you go, update your hypothesis, and do the best right where you are. And everything's going to be okay.
Thank you. So, one way I know especially when you're in school and you're working through, and then you're going to come out and start working in the profession, to do exactly what you're saying, is you got to stay connected to your professional organizations, connected with each other. I think iron sharpens iron. Staying connected within your community helps you, because guess what? You're not going to always have the answers. And knowing that you can call back, tap into those resources, that's only going to help you help that person more. So, I mean, I thrive on the people in my camp. I'm part of my professional organization, the American School Counselor Association, the Florida School Counselor Association. And it's like, how do you have time to do all of that? I know in order to pour out care, I got to pour in. Never forget to pour in. You can always be busy doing all of the things. I know, Mike, you was talking yesterday. We do all the things. We do all the things, but we got to pour back in. For me, this is an opportunity to pour back in, just being here in this room, to see that there's people, they're coming out. You're going to have some help in that role. You're going to have some help. And it's great to know that you all showed up here because you're pouring in. So I think that is an important thing I want to leave you with. Never stop doing that. As he's saying, you never stop growing, never stop changing, never stop learning the new practices, but never stop putting into yourself, because you deserve it.
Well, join me in thanking our esteemed